a PA student. I'll be taking care of you today. Washing my hands. Alrighty. It's so nice to meet you. I hope you're having a good day.
Yes.
Alright, I'm going to write a few things down and then we'll get started, okay?
Okay.
Show me my blank piece of paper. All right, now we can get started. So what brings you in today?
I hurt my wrist.
You hurt your wrist?
Right wrist, yes.
All right, when did this happen?
2 days ago.
2 days ago? And which wrist was it?
The right wrist.
Right wrist. Can you explain the pain for me? Is it a
sharp pain?
A sharp pain? And are there any other associated symptoms to the wrist that you've noticed? No. Does anything make the pain better?
No, not really.
Does anything make the pain worse?
No, just moving it around.
Moving it. And does the pain radiate or is it just in the wrist?
Just in the wrist.
Has the pain been constant or does it come and go?
It's been pretty constant.
And on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced, can you rate your pain for me?
About 6.
6? And have you ever experienced this kind of pain before? No? All right, now I'm gonna ask you, or we'll kind of summarize. So you hurt your right wrist 2 days ago and it's been pretty constant for the last 2 days. Nothing makes the pain better, but moving the wrist does make the pain worse, correct? Okay. Are you having any joint or muscle pain? Any stiffness?
No.
Are you having any cramping? Are you having any swelling to the wrist?
No.
No. Are there any bone deformities to the wrist that you've seen? Are you having any abnormal range of motion?
No.
No. And did you experience any trauma to the wrist?
No.
No. Well, what happened? What made your wrist hurt?
I'm just playing football with my friends.
Playing football. Did you fall on it, or what happened?
Yeah, one of my friends had fell on.
Are you having any weakness or wasting to the area? No. All right. Alrighty. Now I'll kind of ask you some general questions. Are you experiencing any fever?
No.
Any chills?
No.
Are you feeling fatigued?
No.
No. Are you having any discomfort?
No.
Any generalized weakness?
Mm-mm.
And have you had any appetite or weight changes?
Mm-mm.
No. All right. Now I'm going to ask you a little bit of a health history. I'm going to ask about a few illnesses, and I just want you to answer if you have them, or let me know if you have them or if you've ever been diagnosed with them, okay?
Okay.
All right. Have you ever been diagnosed with high blood pressure?
No.
Diabetes?
No.
High cholesterol?
No.
Any heart disease?
Mm-mm.
Have you ever had a stroke?
No.
A heart attack?
No.
And do you have or ever had any cancers?
No.
No. Have you ever been hospitalized?
No.
No. Have you ever had any surgeries?
No.
No. A lot of no's. Are you up to date on all your shots?
Yes.
Yeah, all your childhood shots.
Mm-hmm.
Did you get a flu shot this year?
Yes, ma'am.
Yeah. And was it 2019 or 2020?
2020.
2020.
Mm-hmm.
And do you take any prescribed medications?
No.
Any over-the-counter medications?
Ibuprofen.
Ibuprofen? When do you take ibuprofen?
Whenever I feel pain or get headaches.
Okay. How many do you typically take at a time?
Just 2.
2. Okay. And do you take any vitamins or supplements?
Mm-mm.
No. And do you have any drug allergies or food allergies?
No.
No. Any environmental allergies?
No.
No. All right. Now, I'm going to ask you a few questions about your family. Are your parents living?
Yes.
Yeah.
Mm-hmm.
And can you tell me your parents' ages, roundabout?
Around 40, 41.
40.
Somewhere around there.
Do you have any siblings?
3.
3. How many brothers and how many sisters?
I have 1 brother and 2 sisters.
1 brother. Can you tell me their ages, or roundabout?
8, 10, and 22. Around 20, or early 20s, somewhere around there.
Your brother, how old is he?
He's 8.
And your 2 sisters?
10, and the older one's around 20, in their early 20s.
20s, okay. And then I'm going to ask you those illnesses I was asking about earlier. I'm going to ask them also pertaining to your family. So if anyone in your family has ever been diagnosed or does have any of these conditions, just let me know, okay?
Okay.
High blood pressure?
No.
Diabetes?
Mm-mm.
Any high cholesterol?
No.
Any heart disease?
No.
Anyone ever have a stroke or a heart attack?
No.
And any cancers?
No.
No. Okay. Now I'm going to ask you some more social questions, more questions just pertaining to you. Do you use any tobacco products?
No.
No. Drink alcohol?
No.
Any recreational drug use?
Mm-mm.
No. Can you tell me about your diet?
Eat whatever I want.
Eat whatever you want.
Mm-hmm.
Can you tell me about any exercise?
I play sports, football, soccer.
And do you have a job?
Mm-mm.
No. Are you in school?
Yes.
In school. What grade are you in?
9th grade.
9th grade. All right. So, can you tell me about your living situation? Who do you live with?
I live with my parents.
Parents.
Mm-hmm.
And do they take care of the finances? They pretty much,
Mm-hmm.
yeah. All right. And are you sexually active? Any sexual history?
No.
No? Okay. Alrighty. Well, thank you so much. I was just practicing taking a history today, and I appreciate your time. It was very nice to meet you.
Nice to meet you too.
Washing my hands. All right. You have a wonderful rest of your day.